Anosmia. Anosmia is when you can't detect odors. It's usually a temporary side effect from a cold or sinus infection that goes away when your cold or sinus infections clear. But sometimes, anosmia may be symptom of others, more serious medical issues like diabetes or traumatic brain injury. What causes anosmia? Anosmia may be a side effect of many common medical issues, including conditions that block your nose or interfere with signals sent from your special scent cells to your brain. Conditions that block your nose are nasal polyps, common cold, influenza or flu, nasal congestion, sinus infection or sinusitis, deviated septum, high fever or all allergies, and COVID-19. How is anosmia treated? In most cases, treating the underlying condition improves your sense of smell. For example, if you have sinusitis, antibiotics can help clear up the infections. If certain medication affect your sense of smell. Switching medications may help ease your anosmia symptoms. Ageusia is the complete loss of sense of taste. This condition makes it impossible to detect tastes like sweet, sour, salty, bitter, or umami. Your sense of taste involves lots of parts including taste buds and nerves that carry taste signal to your brain. Anything that damages this part of interferes with how they work together can potentially lead to ageusia. What are the symptoms of ageusia? Having ageusia means you can't distinguish any taste in food or drinks. You may have other symptoms too, depending on what condition causes. This may including high blood pressure or hypertension, nasal congestion, allergies, oral health problems. What causes loss of taste? Causes of ageusia range from health condition and medication to lifestyle-related things like smoking cigarettes. Anything that interferes with the breakdown of food into chemical signals that your brain recognizes as a specific flavor
Cause
can
of loss
impact
of
your
smell and taste. Illness, for example, cold or flu, sinus infection, and allergies. Head injury, hormones changes, dental or mouth problems. Changes in smell of taste. Dysosmia refers to a change in your sense of smell. Familiar objects may smell different or unpleasant, or you may notice scents that aren't there, such as cigarette smoke. Many conditions can cause dysosmia.
What triggers the sense of smell? Substances that smell give off tiny molecules. Inhaling moves these molecules into your nose. Their special cells, olfactory receptors, detect these molecules. The receptors relay this information through your brain, through your olfactory nerve, and allow you to perceive smell. Illness make you smell. Diabetes, gout, menopause, overactive thyroid, liver disease, kidney disease, and infectious diseases. Diabetes, a disease that occurs when your blood glucose, also called blood sugar, is too high. Gout is a common and complex form of arthritis that can affect anyone. Menopause is the time when menstrual periods permanently stop, marking the end of reproduction. Overactive thyroid, also known as hyperthyroidism or thyrotoxicosis, is where the thyroid gland produces too much of a thyroid hormones. Liver disease, referring to chronic conditions that do progressive damage to your liver over time. Kidney disease is a disease characterized by progressive damage and loss of function in the kidneys. And last, infectious diseases are illnesses caused by harmful agents, pathogens that get into your body. The most common causes are viruses, bacteria, fungi, and parasites.
Diseases causes anosmia. Number 1 is high blood pressure. High blood pressure or hypertension has no symptoms and can be dangerous if not treated. Hypertension puts you at risk for stroke, heart attack. Number 2 is the Kallmann syndrome. A Kallmann syndrome is a condition that's characterized by absence of or delayed puberty and a lack or loss of sense of smell. Kallmann syndrome may be accompanied by symptoms including hearing loss and cleft palate. Number 3 is Parkinson's disease. Parkinson's disease is an age-related degenerative brain condition, meaning it causes parts of your brain to deteriorate. It's best known for causing slowed movements, tremors, balance problems, and more. Most cases happen for unknown reasons, but some are the Sjogren's syndrome. Sjogren's syndrome is an autoimmune disease that happens when your immune system damages the glands that produce and control moisture in your body. The most common symptom is chronic unusual dryness in eyes, mouth, and vagina. Number 5 is the Alzheimer's disease. Alzheimer's disease causes a decline in memory, thinking, learning, and organizing skills over time. It is the most common cause of dementia and usually affects people over the age of 60. Number 6 is the brain cancer or brain tumor. Brain tumors can be malignant, cancerous, or benign, non-cancerous, and can affect children and adults. But whether they're cancerous or not, brain tumors can impact your brain function if they grow large enough to press on surrounding tissues. Number 7 is the multiple sclerosis or MS. Multiple sclerosis or MS damages the protective cover around nerves called myelin in your central nervous system. It can cause muscle weakness, vision changes, numbness, and memory issues. While there isn't a cure, treatment option can help you manage symptoms and slow disease progression.
Autoimmune disease causes heightened sense of smell. Aperosmia is a common symptom of some autoimmune disorders that can also occur when the kidneys do not work correctly, which can lead to Addison's disease, an adrenal gland disorder. Systemic lupus erythematosus also affect the sense of smell, primarily due to its impact on the nervous systems. Why lost my sense of smell and taste? Anything that irritates and inflames the inner lining of your nose and make it feel stuffy, runny, itchy, or drippy can affect your sense of smell and taste. This includes the common cold sinus, infections, allergies, sneezing, congestion, the flu, and COVID-19.